While we're doing that, I wanted to introduce Taiisa Kelly. She's a co-worker of mine. She heads our efforts to end homelessness. She's going to talk a little bit about some of the national studies that have shown that there's a racial disparity among the homeless. I know that's shocking and surprising, but in fact it is. And then she's going to introduce Renee Kulianis after that. We'll talk about their report on poverty.
Good morning, everyone. Now you're kind of getting settled, but I want to thank you all for taking the time this morning to make the trip down here and to start this important discussion and to participate in this important discussion that we have before us. I'm really encouraged to see such a diverse crowd that's here today to start to talk about these critical issues and to look at race in America, segregation, racism, and its impacts and how it's been affecting us to this point. I would like to say, let's give Richard Rossi another round of applause. I want to commend him for all of the great work that he's done in helping us to understand the history of how we got to where we are today. When I think about this conversation, it reminds me, if I was more eloquent, I would have great quotes to say right now, but all I can say is that it reminds me that we really can't have a clear path to a bright future if we don't understand where we came from. And so it's really important and critical for us to understand the historical context that brought us to the point where we are today before we can effectively address the challenges that we're facing. And I think that this work like The Color of Law, like, just different works like The Color of Law, works like The New Jim Crow, works like from other authors and other people who are talking about issues of segregation and racism in this country are really critical for us to begin the conversation about what's happened, how we got to where we are, so that we can address how we are going to move forward to address these issues. This issue reminds me of the process we go through when we are sick, when we have an illness. When you first get sick, you have a couple of signs that something is wrong. You can kind of brush it off, ignore it, but eventually it gets to a point where the symptoms get so bad that you can't really ignore what's going on. They're so bad that you decide, I'm going to go to the doctor. I think most of us do that. You go to the doctor, you tell them what's going on, they examine you, and they give you a diagnosis. They explain what's wrong with you, what's going on. And then the next step they take is to talk to you about the treatment options that you have, whether it's medication, lifestyle changes, so you can figure out how to heal yourself from the illness that you have. Much the same way, racism, segregation is an illness that plagues our society. And it's now up to us to figure out how we can understand the diagnosis, and then start to address it and treat the illness that we're facing. And we must decide that we are not going to be that bad patient that goes to the doctor, gets the diagnosis, but then does nothing, does not engage in the treatment, and then stops at understanding the diagnosis. We must make the choice that we are going to be the good patient that gets the diagnosis and then takes the steps that are necessary to treat the illness that we understand that we have. And I think that these conversations are really important in us first understanding the diagnosis, but then also helping us to figure out how we can treat this illness that is before us. So, as Richard mentioned, I work with the Ending Homelessness team at Monarch Housing, and in that role, I work with communities across the state to address homelessness and to figure out what's going on in their system and understand how to better serve people who are experiencing homelessness, and to make sure that the responses and the resources that we provide are responsive enough to help people get into housing as quickly as possible. For many people, myself included, homelessness is seen as a failure of all of our systems to adequately support our neighbors, our brothers and sisters. Before a person becomes homeless, there are lots of different systems that they touch, whether it be education, the healthcare system, the criminal justice system, employment. There are many different systems that they touch before they become homeless. And on that way to becoming homeless, all of those systems have interacted with them, but have not been able to really address and help them come through to something sustainable and better for them. Often homelessness is kind of seen as a result of extreme poverty. But I think, as we've heard today, it's not just about poverty. And in homelessness, we often talk about poverty being very related to it, and we will often hear that people describe homelessness as a result of people's personal failings. We attribute it to people not applying themselves in school, not getting a good job, not working hard enough, engaging in drug abuse or substance abuse. All of these things about people's choices, individual choices that have led them to a place where they are now experiencing homelessness. The challenge is that when we view homelessness in this way, the solutions that we come up with are all geared around fixing the person because the person has done something wrong. And that might work for a few if that was truly what the issue was. But we must understand that homelessness is bigger and broader than just individual decisions and choices of the person, and that there are other forces at play. When we look at the data, and this is something that many people who have worked in the homeless field have known kind of anecdotally, but when we look at the data, we see that it is not just about personal choices, it's not just about poverty, it's not just about having a house or having income. It's about a lot of other pieces as well. I mean, if it was simply a matter of bad choices, everybody who made the same types of choice would become homeless. But when we look at who actually experiences homelessness, we see that African Americans, Black people, are disproportionately affected by homelessness in the state, not only in New Jersey, but across the country. We've always understood this. I believe people who have worked in this field have always seen this and understood this, but it's never really been delved into, and I think it's important for us to take the time now to start to look at that. The Center for Social Innovation launched the SPARK initiative. SPARK stands for the Supporting Partnerships for Anti-Racist Communities. And the SPARK initiative focuses on understanding racial inequities in homelessness. They released a report this March, which talked a bit about racial inequities in the homeless system, and the findings in their findings, they highlighted some of the ways that systemic racism has impacted our society and resulted in homelessness, and how it's being perpetuated through our homeless services. For the study, they focused on 6 communities in America, and they looked at demographic data, service data, they looked at, they did surveys within those communities, and they took oral histories. So I want to just go over a couple of the findings that they found in this study. In the 6 communities that they looked at, about 2/3 of the people experiencing homelessness were Black, and about 78% of them were people of color. Now, when you look at that in comparison to the general population, 73% of the general population of the United States is white, but they made up about 28% of the population experiencing homelessness. On the other hand, about 12 to 13% of the general population is Black, yet they made up about 65% of the population experiencing homelessness. Now, it could be easy to say, well, if you're looking at the general population, that doesn't really tell us very much. What about the population in poverty? Because poverty is so closely linked to homelessness. But if we look at the comparison of those experiencing homelessness versus those who are in deep poverty in this country, we see similar things. For the population who are considered being in deep poverty in America, white people represent about 45% of that population. And again, they represent about 28% of the population experiencing homelessness. And in contrast, Black people represent about 34% of the population in deep poverty. But again, they represent 65% of the people that are experiencing homelessness in this country. There are a couple of other things that they went into looking at specific subcategories, but one that I did want to highlight is that for homeless youth between the age of 18 and 24, young people who are out on the streets or living in emergency shelters before their lives have really begun, about 78% of them were Black. Now, what does that say for the future of African Americans when there are so many of them at such a young age experiencing homelessness? The study also looked at a couple of other interesting areas. They looked at the workforce of agencies that are serving the homeless population. And what we found is that for those agencies that are providing services and working with those who are experiencing homelessness, unfortunately, they don't reflect the population that they are serving. When you look at their senior management, when you look at the case managers that are providing the services, the majority of the people that are in those agencies that are employed to help the homeless are white. yet the majority of people who are experiencing homelessness and accepting these services are African American. Now, this in and of itself is not a problem specifically, but it does have implications in how those services are provided and whether or not those services truly speak to the needs of the people that they are trying to serve. Some of the key domains that this study found that are impacting homelessness for people of color were economic mobility, access to housing, criminal justice involvement, behavioral health needs, and family stabilization. These are all things that we know. But the unfortunate reality is that systemic racism plays a significant role in how people of color experience all of these domains. And so we can't address homelessness and address how people are navigating through these domains without understanding racism, without accepting that it's there, and without talking about it and dealing with it head on. So there's still a lot that needs to be done in terms of research and in terms of understanding how segregation, systemic racism, impact homelessness and impact the system. But regardless of what other research we need to have happen, we do know that it is playing an important role, and that it is something that we must address today if we want to see a true end to homelessness in New Jersey and in this country. So we now have an opportunity, as I said before, to take all of this information, to hear the diagnosis, and to start the conversation about what are the treatment options that we have, what are the ways that we can do things differently, and be more deliberate about the work that we do so that we can truly end homelessness and end segregation and systemic racism. Thank you.